Hello, everybody. This is Gary. Today is January 14th, 2022, Friday. It's 6:52 p.m. Eastern Standard Time in the United States in Rochester, New York, and this is my coping with schizophrenia blog entry for today. Today I'm doing a little bit better than yesterday. I still have some physical pain, but it's not as intense as it was in the past few days. Um, I had a medical appointment today with my gastroenterologist. We just went over my digestive health, the fact that I'm pre-diabetic and I have high cholesterol, and that my primary care doctor wants me to control my blood sugar and my cholesterol by changing my diet instead of using medications. Overall, my digestive health is pretty good. Um, I told my gastroenterologist that I have to take Laxative because my psychiatric drugs can cause severe constipation, which could lead to visits to the emergency room with an impacted colon, which has happened several times, many times actually, over the past 3 years. Um, take the laxatives to prevent that. Other than that, we pretty much agreed that my digestive health is pretty healthy. I do have some acid reflux and heartburn from time to time. Um, but other than that, I stuck to my daily schedule today. I exercised on my exercise pedal bike. I went out and kept my medical appointment. I went and picked up some prescriptions. Um, did some work on the computer. I do consumer surveys for money online. And I did meditation this morning. And I'm making this video as part of my daily schedule. I try to make at least one video per day. I may just start to decide to put more than one video out per day. As far as my schizophrenia symptoms are concerned, they're not that intense today. My auditory hallucinations are pretty low key. They're at their baseline. My depression is not that bad. My anxiety levels are not that high. Um, my delusions and my paranoia are not that bad today. I was outside today for several hours, and I don't think that I felt like anybody was following me or anything like that. That comes and goes, that feeling. Um, my next psychiatry appointment isn't until February 3rd, February 2nd or 3rd, one or the other. I have a therapy appointment on the 20th of this month. I'm seeing my primary care on the 21st of January. We're going to talk about my continuing physical pain and starting physical therapy and how the medications they prescribed are helping my physical pain. They put me back on Neurontin to help me deal with the physical pain. I'm taking 600 milligrams 3 times daily. They put me on Flexeril to deal with the muscle pain. I'm still having a lot of joint pain, especially in my knees when I'm walking. That may be due to the fact that I'm overweight and it's putting stress on my knees and on my ankles, causing pain in my calves and my thighs when I walk, and even when I'm not walking. Um, so we're going to try physical therapy for the physical pain, and my psychiatric symptoms today are not that intense. I do have a group therapy session coming up this Tuesday, at least it's scheduled for Tuesday. Last Tuesday's group was canceled because the therapist couldn't make it into the office to run the group. So that tacks on an extra week to the number of groups that we're going to have because it's a 10-week therapy session, one group a week for 10 weeks. And since we missed a week, we're going to tack that extra week on at the end, and it's still going to be a 10-group, 10-week process. Um, the group therapy centers around what's called DBT, uh, which is dialectic behavior therapy. It's just a type of therapy to teach you how to deal with and tolerate stress and mental health symptoms, external stresses and internal stresses like my paranoia, my delusions, my hallucinations, my anxiety, my insomnia, my depression, tolerating those things better without necessarily trying to get rid of them. You can look up DBT therapy or dialectic behavior therapy on Google to get more information. We didn't change any of my medications today. I'm still on the same digestive health medications that I've been on for a while. Sucralfate to prevent ulcers, Protonics to treat acid reflux, and Zofran to prevent nausea and vomiting, which I take 3 times a day because I tend to get nauseous when I'm really, really nervous. And Zofran helps control that part of the anxiety when I get nauseous and I feel like throwing up. Of course, I still have clonopins like Prexat as a useful tool, which I'm going to use after this video and try to do some more meditation. I try to meditate at least twice a day. Some of the meditation channels on YouTube that I recommend are Meditation Vacation, Michael Seeley, Jason Stevenson, Tansy Forest, Michelle Sanctuary. Those are all good. Slumberland with, I forget his name, but it's called Slumberland. Those channels are all good for online meditation. I usually meditate in the morning when I get up because I feel panicky every morning. And I usually meditate just before I go to bed, or a couple of hours before I go to bed. But that's all for now.